Okay, guys, how are you going, guys? How is everyone of you guys doing? Hi, Dr. Ravuri, how are you going? Dr. Koshik, I'm very happy to see you back again, Dr. Koshik. Hi, Dr. Sipi, how are you going? Dr. Navneet, how are you going? Dr. Dania, Dr. Leia, Dr. Pronima, Dr. Movia. Wow. How are you going, guys? How's everyone? Dr. Wayne, Dr. Saeda, Dr. Preya, Dr. Karen, everyone, guys. How is the preparation going, guys? How is the video with you? Thank you, Dr. Movia, very much. Thank you, guys. Guys, did you finish Delicious and Pedopedia? Oh, wow, I'm very happy, Dr. John. I'm sure about this. I'm very happy, guys. Amazing to the point, post of revision. I'm very happy to pray. I tell you this. Okay, guys, I hope, guys, every one of you be motivated enough to study. Because you know what? On daily basis, guys, when I see you in academy in part two, I feel very happy and very proud that all those guys have a belief that every one of you guys going to pass. When I see the candidate in the academy, I keep asking myself always, give me guys please 1 second because I need to do something here. The candidate in the waiting room, I need to admit them. They are late. May I just do this one here. Okay, guys. Let me just do something else as well. Okay, guys. So I hope every one of you guys doing great. Today, we're going to discuss paper 1, section 3. And guys, I hope every one of you doing great. And then I just asked you a few minutes ago about video, and then I feel every one of you guys happy. You are motivated, and this is actually the spirit that I want every one of you guys to have. In academy, today in academy, and every day, because I see you guys either in academy or on the sessions. So I always feel guys very happy and very proud. That's I have you. I never ever, guys, lose my trust in you. I always, guys, know you're doing the best. I always say this patch is the best patch. This is start from this course. We see this. That's guys from the first day. You've been doing great. You're helping each others. You actually, guys, going through all the questions through the mocks we do, either on our daily Telegram mocks or on my sessions, mocks like the mocks now we do in here. And also the mocks, guys, we run it on online or alpha mocks, you actually score high. And that's why, guys, I feel very proud of you. And I feel you're gonna be the best batch ever after triple one batch. I think you will be even much better than triple one batch. And that's, guys, really what I want from you. And you promised me, guys, that's every one of you guys going to pass. You promised me this. You see, the questions are easy questions. The answers are easy answers. So they only need to practice. We are now very focused on the questions and answers rather than just to get distracted by irrelevant knowledge and irrelevant information. So guys, I hope guys, all of this helping you really to pass the exam. Yes, yes, guys, you will all pass. Definitely, guys, you all gotta pass. I'm very, very optimistic about this. I'm positive about it. Thank you very much, Dr. John, for your promise. I believe in your promise. Okay. Dr. Bido, my alpha mock is not working since afternoon. Please help. Please, admin, can you find out why Dr. Navneet alpha doesn't work? Most probably that could be something. Look, Doctor, this technology part, I'm not very good in it, but most
Hello.
probably that could be because of maybe a browser, could be a connection. But if it works for all other candidates, it could be something in your system. But if it drops and it dropped for all other candidates, maybe the app system or website system.
Hello, Dr. Adam.
Hello?
This is Dr. Leah. Hi, doctor. Hello,
Hi, Doctor.
everyone. I hope everyone is doing great. So I just want to clarify this part. The last 2 days, there has been some updates happening on the website and the app. So it was working well. These updates to improve the system for you and to ensure that it's been updated with the last recent updates in the system. So it's been fixed today and it should be working fine with everyone. If you still have issues, just text us on the page. Okay. But ensure first you are using the same email you gave it to us for the first time because it's only one email, one access, one device. And in the same time as well, ensure you refresh your page if website or app you refresh it first and close it completely, then reopen it again. Okay? And it will be working fine with you. If you still have issues, you can surely text us on the page. Thank you, everyone, and I hope you are doing great.
Thank you, Dr. Lay, for this update. Okay, guys, so please, guys, what you need to do is you need to log out completely from your account and then log in back again. Ensure, guys, you use the same email address. Ensure, because sometimes even you think you use the same email address, but actually the system takes you to different email address. That could be the login details saved in your laptop for different email address. So guys, ensure please, when you log in into the system, ensure you log in from the same email address you gave it to us. And then guys, I believe things will be fine with you. Thank you very much, guys. Guys, are you ready right now for paper 1, section 3? Okay, guys, we have about 70 question, guys, in here, about 60 something, almost 70 questions. So, guys, we need to finish all of them today. And I believe, guys, you went through them before. Am I right? You answered them. Guys, did you answer this question your own before? How much did you score? Consider it, guys, consider exam questions. Consider one paper. This is going to be good mock to you. Is it like a close to 70? Get 2 hours, set 2 hours, and try to answer them as a 70 question paper. So, guys, how much did you score in this paper? Very good. You did it yesterday. Very good. 6 wrong only. Very good. Still very good then. 4 wrong only. 11 wrong. Okay, please. 11. We need to find out why 11. 87, 83%. 10 only. Very good, guys. I'm very happy. 3. Okay. Everyone, please, guys, keep why you did wrong answers. And then once we answer the question, guys, things will be clear to you. Ready, guys? Everyone of you guys ready? Let's start. That's okay, Dr. Ravori. Look, the target and the goal is to go through them and know them. That's it. If you know them now and you're happy with them, that's okay. Okay, guys, all the best to everyone. Let's start. What is, guys, the answer first question? We already did the answers, right? Please, guys, every one of you, ensure that you answer this paper before we go through it. So in this case, guys, we can be fast. And we can answer as many as we can from questions. Okay, so the question, guys, ask about what is the most appropriate classification for 255. Guys, this is 5, right? Quadrant, the patient himself is 4-year-old. What does it mean? This quadrant 5, quadrant 6, quadrant 7, quadrant 8. So 5, 5. Right, guys, it should be 5, 1, right? It should be 5, 1. 5, 1 has only enamel loss, like a little bit of enamel only, like this part. So in this case, guys, what is the fracture should be? The fracture is enamel fracture. So that's, guys, 5, 1. And only, guys, from the photo, not just the wordings, a little bit fracture has happened in the enamel part. So, guys, answer C, enamel fracture. Now, what best describe the clinical finding for 6-5? Look at 6-5. Enamel part has been chipped and also dentin. So in this case, 6-5 has uncomplicated. Uncomplicated means there is no bulb exposure, right? So 6-1 has fracture in both enamel and dentin. As shown here right now, exposed dentin. So enamel and dentin, and pulp not exposed mean uncomplicated. In this case, guys, the answer should be B, bravo, fracture through enamel and dentin without pulp exposure. Very good. Question 3. What would be the most appropriate radiograph action in this case? No radiograph needed, no. Just, guys, keep in your mind, as long as there is a fracture or luxation, you should take an X-ray. Guys, is that, guys, clear to you? If there is fracture, like enamel fracture, enamel dentin fracture, or luxation, guys, do you think concussion is a luxation? No, concussion, no luxation. This is not mobile. So if you have a mobility or displacement, call it displacement better. If you have displacement or fracture, you should take an X-ray. Easy now? What about concussion? Concussion, no displacement. So don't take X-ray. Okay? No radiograph. A is wrong. B, take a periapical. Yes, periapical, guys, is a gold standard for us for luxative and fracture and trauma injuries. Okay, guys? Periapical X-rays. Now, which size, guys, will you use? Size 0 or size 1? Yeah, we can go with size 0. What if the child is about 11-year-old or 12-year-old? Which size gonna use? Size 1. 11-year-old. For one tooth, only size 1. For two teeth, size 2. For one tooth only, like fracture has happened in one tooth only, size 1. If you're going to take the two teeth together in one go, you can use size 2. Okay, now it's good. So the answer, guys, B, bravo. Take a periapical of 5, 5, and 6, 5 for baseline. Very good. What about sensibility test? No sensibility test. Why? Because he's a child, and in child, sensibility test is not reliable. Question 4. What is the best management for the enamel fracture of on tooth 5, 5? Tooth, guys, 1, 5. Just an enamel, dentin even not exposed, no even sensitivity. It's just enamel, a little bit of roughness only. So in this case, as long as dentin not exposed, dentin not sensitive, in this case, what we can do is we just smooth the sharp edges and that's it, and review. The answer B, bravo. Very good. Question 5. What is the most appropriate treatment for the enamel dentin fracture? Now dentin is exposed. Dentin is sensitive. I cannot just only smooth it out. I need to fill it. So what we need to do is we need to cover the exposed dentin with GIC, glass ionomer. Why not composite? For many reasons. For many reasons. One, glass ionomer bind to the tooth chemically, has better retention. Two, glass ionomer is insulating to thermal and to electrical better than composite. Glass ionomer, the coefficient of thermal expansion very close to the tooth structure. Glass ionomer are good for water. Like it, if the child actually may have a little bit of wet environment, so it's good with water. Glass ionomer has fluoride release. Glass ionomer, it's not sensitive technique, easy to do it, and quicker than composite, so the picture will not last in the. Glass ionomer has a good strength. Glass ionomer also has a good shade, right? All of these factors making me to choose glass ionomer for kids, and strong enough, be bravo, not composite. Question 6, please, guys. What type of fracture is visible on tooth 7-1 in the photo? It should be 6-1. 7, oh yeah. 6-1, 7-1, this one. The one, the bottom. This one. Okay. Is it enamel only or enamel and dentin? Both. Seems like enamel and dentin because it's a child, and as long as more than 1-2 millimeter, dentin will be exposed right away. So guys, we're talking about B bravo, enamel and dentin fraction. Question 7. What additional clinical finding is evident in the photo? When you look at the photo, you find something happening. Yes. Please, guys, be careful, right? In exam, there will be similar question. They ask you what are the missing teeth. You need to count nicely. So this is 7-1, and this is 7-2. 8-1 not existing, and this is 8-2. This is canine, that's canine. So canine, then canine is 8-3. 8-2, 8-1 is missing. So the missing is 8-1. So guys, question 7, the answer is missing 8-1. I hope it's clear. Elijah, a 4-year-old boy, was brought to Aurora Dental Clinic after an unwitnessed fall, like no one has seen him, onto compacted soil and the grass. He was found crying with dirt on his face and appeared briefly dazed. Dazed. Okay, let's see. His immunization status is unknown. He avoids eating and touches his upper lip. No soft tissue injuries as seen. Clinical findings 5-1 is intact. Normal position, but tended to percussion. Seems like we're talking about which the guy's diagnosis. No displacement has happened, but tender. We are talking, guys, about concussion case. So the first case, the first diagnosed gas 5-1 is concussion. Tooth 6-1 has visible fracture involving enamel and dentin and pulp exposure. What's guys diagnosed guys for 6-1? Is it complicated, not complicated fracture? It's complicated. Why complicated? Because there's pulp exposure. Now, consider lesions may have lost consciousness. An adult witnessed, and no adult witnessed the fall. What is the most important step initial? Lost consciousness, we always say. Patient health comes first. So the answer, guys, is D delta. Guys, if I ask you, the Australian Emergency Service, what are, guys, the numbers for Australian emergency? All the numbers, not only one, all the numbers. There is one more number. Good. There are 3 to 4 numbers, guys, we use. We use 000, 106, and 112. Okay, guys, please, guys, keep this, guys, in your mind. This is very, very, very important information. So the answer, guys, D delta. Question 2. Considering Elijah appeared dazed and now feels nauseous, which are must be assessed first? Which area must be assessed first? Yes, exactly, guys. Why? Because think about it clinically. What she was doing, she's actually dizzy, right? Dizziness happening mainly because of head and neck injuries. Okay, so the answer is head or the neck injuries. See, Charlie, especially if she was driving motorcycle, especially if she was um using bicycle. These people, guys, when they hit the floor or they hit the ground, they hit the head and neck first. So the answer, guys, C, Charlie. Has now returned to your clinic after being cleared medically. Based on the clinical finding, what's the most likely diagnosis for tooth number 51? Concussion, right? D delta. We say this, concussion injury. Question 4. What is the most accurate description of the injury observed in 261? Complicated crown fracture with pulp exposure, D delta. Perfect. What is the most appropriate radiograph recommendation tooth number 51? Is it 51? No radiograph. Why no radiograph? Because it's a concussion. But when exactly we may need taken radiograph later on, especially if you see any signs of mobility or discoloration or tenderness or necrosis. Okay, admins, we have candidates on the waiting room admins. Who's the admins here with us? Lara. We have candidates in the waiting room. Okay. Yeah, I admit them by myself, but see where is the Okay, guys. So the answer is E echo. Next question. Amina is a 5-year-old girl. Was brought to dental clinic by her widowed mother 1 week after falling on a concrete at school. She has a history of rheumatic heart disease. Oh, be careful. aggressive treatment should be done. Patient with trauma and with a history of rheumatic causes, aggressive treatment like extraction should be done. Okay, tenderness because of infection, yes. Is under regular medical follow-up. Long-term medication. Her mother is concerned about the gray color. Frontus and mentioned that the family has limited access to transport and medical and child care support. Means like they will not be able to come to you again, like do the treatment now. On examination, tooth 6-1 has no visible fracture or mobility but shows distinct gray discoloration. Again, most probably we're talking about guys, tooth 6-1. What is the diagnosis? Concussion has happened. Why? Because there is no mobility and no fracture. Tooth 5-1 present with complicated crown fracture. That's okay, no swelling. Now, what is the most likely cause of gray discoloration of tooth 6-1? 1 week after trauma. I don't think at all necrosis can happen in 1 week time. I don't think so. So the answer, guys, is, and there is no palpable changes will happen. There is no palpable changes should happen in this 1 week. So that's why what has happened is, see Charlie, internal hemorrhage, which is hemosiderin, following concussion. Guys, obliteration, canal obliteration will not happen now. So guys, the answer is C, Charlie. Question 2. The mother is concerned about the great discoloration of 261 1 week after trauma. What is the most appropriate advice? Please, guys, read this question properly. This is a very important question. Answer, guys, D delta. Reassure the mom that discoloration may be transient and the more to the tooth. Why? Because gray discoloration, guys, is good things, not bad things. Gray discoloration means the pulp is still live. There is a chance that the pulp is still live. Answer, guys, D delta. Next question. When should a diagnosis of pulp necrosis in tooth 6-1 be confirmed? Very good. See, Charlie, do you remember, guys, the mock exam? If there are signs of infection, radiographic changes, or a sinus tract, any of these. Yes, doctor, extraction can be done. Yes, yes. Based on the medical history. But let's see if there's a question about this one, doctor. So, guys, answer C, Charlie, if there is any signs of infection or radiographic changes or sinus tract. C, Charlie. Next question, guys. Question 4. The mother requests anesthetic solution for the scar tooth 6-1. What is the most appropriate response? Are you going, guys, to give it now or later on? A is very aggressive. Don't do any preparation at this age. B, veneer placement, again, preparation. No need for veneer. Composite veneer or partial restoration if pulp remains healthy. Both of these may not need for preparation. So C, Charlie is the best. Question 5. What is the appropriate treatment for tooth number 5-1 with complicated crown fracture? Complicated. What does it mean complicated? Means you need to do pulp treatment. Now the patient has rheumatic heart disease. If you're going to do any pulp treatment, this pulp treatment, you're going to get higher risk of infective endocarditis. And because you have high risk of infective endocarditis, in this patient, most probably will end up with a serious medical condition. So we don't care about the deciduous tooth because the deciduous tooth is something easy to be replaced, but we care about the heart. That's why it's much better than to do extraction rather than saving the tooth. The answer, guys, D delta. Noah, a 5-year-old boy, was brought to your dental clinic by his aunt after falling forward over the handlebars of his bike onto a gravel farm, a driveway. Well, that is very scary. Gravel farm driveway, very scary. Here, maybe a ghost, right, guys? It should be a ghost. Anyway, he reports mouth pain and difficulty closing his teeth properly. Okay, look at this, guys. Difficulty closing teeth properly. From this word, guys, what do you think is diagnosis? They are not able to close the teeth together. Great, displacement has happened, but what sort of displacement? Lateral luxation. Good. He has a history of mild asthma and antihistamine and is fully immunized except for the unclear tetanus booster stats. The family lives in rural area and access to care is limited. Means like you should do something by yourself. His aunt, his primary carer. As parents often work away from home. On clinical examination, 5-1 visibly displaced out of the line. Angle palatally. Angle palatally, what does it mean? Palatal luxation, right? Good. Immobile, locked. Guys, that's a key word. The keywords for lateral luxation are immobile and locked. With occlusal interference. To 6-1 missing from the socket, avulsion. What clinical investigation should be done first as baseline for 2051? Easy, guys. X-ray, right? Periapical X-ray will be good. Occlusal 5, periapical is fine. But periapical comes first and then occlusal. Both of them, by the way, fine. Periapical radiograph size 2, occlusal radiograph size 2. How old the patient? Yeah, if we're talking about 5-1, only one tooth, we need size 0. If we're talking about 2 teeth, we need size 2. So most probably, guys, occlusal radiograph size 2 will be good. D delta first and then E. But E, if it's size 0 only, will be good. Okay, guys, answer is D. E, it will be the first choice if size is 1, if 0. If E guys, periapical X-ray size 0, it will be the best option. But because we don't have this option, we don't have size 0, that's why we go with occlusal radiograph. If they are 2 teeth together in one go, you're going to take two teeth together in one go, I would go with size 2. Periapical, but with modification of the angle, like going to be more like occlusal as well. What is the correct treatment approach for tooth number 6-1, guys? Are you going to reimplant to 6-1 or are you going to chuck it in the basket? Chuck it in the basket. E echo, don't replant. The answer, guys, they said was teeth, we don't replant them. Question 3. What is, guys, the answer for question 3? Which finding most supports diagnosis of lateral luxation? Locked and not mobile with occlusal interference. See, Charlie. Question 4. How can you differentiate lateral luxation from extrusive luxation? Answer, guys, D delta. Locked and mobile. That's lateral luxation, but extrusive luxation will be loose and mobile. So, guys, lateral luxation locked and immobile. Extrusive luxation loose and mobile. Do you know, guys, but ending, like by finishing these questions, do you know that you will be, guys, knowing trauma guidelines by heart? Do you know that in this paper we discussed mostly, almost all questions related to trauma guidelines? So, guys, answer, guys, D delta. Question 5. What do you think, guys, answer for question 5? I see most of the answer each other, and that's true. If you have a trauma to one tooth, and then you end up with a change in color, for example, or deformation of enamel, in this case, guys, we call this condition as Turner syndrome or Turner hypoplegia. And dilaceration also, guys, can happen for 1-1. What does it mean, guys, by dilaceration? Guys, what does it mean, guys, by dilaceration? Very good. Dilaceration, guys, can happen to both. Can happen to the crown and can happen to the root. What does it mean? They will be bent, curved. Okay, that can happen to the crown or root. Which one, guys, more serious? Do you think dilation to the crown more serious or dilation to the root? To the root, okay? Very good. Question 6. What, guys, do you think the answer for question 6? So the question, guys, about Noah present with generalized caries with visible cavitation. What is the most significant contributory risk factor in this case? Which medication, guys, is taken? Was antihistamine? Right? Antihistamine, guys, result in dry mouth. That's why B Bravo is the best answer. Reduce cerebral fluid due to medication. We haven't had anything about diets or the rest of other things not actually mentioned in the scenario. But B, the one is mentioned. And by the way, B is very, very, very strong risk factor. Question 7. If the avulsed tooth is a permanent incisor, what is the correct immediate management if it cannot be replanted at the scene? Definitely, guys, this is happening from the father or from the teachers. Like the parent or the teacher, they ask us on the phone what we need to do. I cannot replant in the tooth at the scene. So what should I do now? We ask them to keep the tooth in milk and replant it as soon as possible. Sometimes, guys, we can keep the tooth on the buccal vestibule inside the patient mouth if possible. Okay, or otherwise we can ask the patient to spit in something and then keep the tooth in the spit until they come, which is saliva. Okay. Sometimes even we do with foil, like paper foil. Sometimes we do it with clean wrap. You know, guys, a clean wrap for food, the one we buy, guys, from Coles and Wallis. Yep. Okay. A 15-year-old Ethan Morris, high school student, was involved in bicycle accidents on the way. Mother is a nurse. Okay, means like she will be able to help him. Was present. His mother. Seasonal asthma. Antihistamine again. Rural area, nearest dental clinic 45 minutes. Not bad. 45 minutes, less than an hour, not bad. At the time of injury, tooth 1-1 was completely avulsed. Okay. 1-1 was extrusively luxated. That's extrusive luxation. Okay. Picked up the avulsed tooth by the root. Bad, bad, bad one. Rinsed under tap water. Another bad one. 45 minutes still okay. And placed in a tissue in handbag. Very bad. Tissue is dry. Well dry the tooth. They arrived at Turkey 75 minutes. Very bad. Timing is the worst. Is it timing or the worst? Yes, timing is the worst. Timing is even much more worse than tap water. Even much more worse than touching the tooth. The tooth was 2-1 is missing. Ethan is anxious and want to know if the tooth can be saved. Okay. Based on the scenario, what is the most important factor affecting the prognosis of 2-1? Timing. I believe tooth out from the socket is very bad. The age of the patient, nothing related. The type of trauma, nothing related. The presence of asthma, nothing related. Where the one is traumatized. Even guys, even timing, even much worse than you wash the tooth under running water, tap water. See Charlie, guys. What is the impact of keeping the tooth dry of more than 60 minutes? I think, guys, periodontal ligament will not be surviving anymore, right? It's dead anymore. Yes. Answer, guys, should be D. The periodontal ligament cells are likely non-viable and prognosis poor. However, will you reimplant it or not? Yes, we still replant it as well. Which of the following was an incorrect step by Ethan's mother? Picking the tooth by root, or rinsing under running tap water, or placing it in a dry tissue. All of them, right, guys? All of them. She did everything bad. She's a nurse, right? She's a nurse. Okay, maybe she wasn't her good day then. She doesn't understand. Maybe she's not dental nurse. Okay. Answer, guys, all of the above. But she's good, mom. Okay. Okay, guys, if you want to do A option, correct A, what should be, guys, the right thing? Holding the tooth by the crown. Rinse it under what, guys? Rinse it under what or with what? Someone said saliva, right? Last time. How come saliva? I don't know. It'd be too much saliva, right? Milk, guys, will be good, okay? If there is milk, will be good. It should be, guys, kept in what solution, guys, the best? Milk. Guys, not Hank solution. Hank solution not the best option in Australia. The best available option is milk, not Hank solution. Not Hank solution. Hank solution not the best in Australia because it's not available. It's good overall, like as in if you find it, but it's not available, guys, everywhere. Okay, question 4. What is the most appropriate management for tooth 2-1 at this stage? Laxative injury, right? Full cream. Full cream is much better. We like the full cream. Guys, what is the most appropriate management, guys, for tooth number 2-1? Okay. Someone said grass feed. Look, guys, someone said the best is grass feed full cream. Dr. Harvin said this. The grass feed. You know what? It should be the Wego. Okay? Should be Wego milk. I don't know Wego has milk or not, but not sure. I think Japanese people they know this better than me. Anyway, yeah, the Wagyu milk, yes. Guys, Wagyu guys has milk or not, or just meat? Because it's not okay, guys. I'm not sure. Anyway, okay, guys, what is the most appropriate gas management for tooth number 2-1? That's what I thought. Wagyu, it's not. Yeah, it's a bull. Yes, it's not not a cow. Like it's not whatever. Okay, A alpha, guys, immediate replantation and flexible splinter for 2 weeks. Very good. Question 5. What is the most likely diagnosis of tooth 1-1, guys, based on the clinical findings? Extrusive luxation, right? See, Charlie, easy one. What is the immediate treatment plan for tooth 1-1? Extrusive. Again, splint for 2 weeks. Flexible splint also. Why is milk preferred over water as a transport medium? See, Charlie, milk preserves the peduntal ligament cells viability. Vitality or viability better than water. Very good. What is the rule of fruit maturity in a vulgin management? Open apex teeth has better healing potential, definitely, because revascularization. Closed apex teeth has a higher risk of pulmonary necrosis, definitely, because that means you break the nerve from the end. Open apex favors spontaneous yes, that's what I said. A is good. A and C, they are confirming each other. B is correct. Root maturity affects prognosis and decision making. Definitely, that's true. E equal. Eczema, fully vaccinated, including tetanus vaccination. Paramedics, his father. Okay. Trampoline during birthday party. Fail phase, okay, first onto a metal bar. His father found tooth one on a valve, 15 minutes. 15 minutes is a good time. Culture clinic says we are 15 minutes away. What should I do right now with a teeth doctor? Rinse the tooth with water, wrong, and come to clinic immediately. We don't like to rinse it with water. Scrubbing and handling the root of the tooth, wrong. Reimplant the tooth in the socket if possible and have, okay, yes, actually bite on a gauze. Yes, see, Charlie is good. We don't like insulin. Place the tooth in milk and bring it to the clinic. No. D delta not good as C Charlie because C you just replant it. Very important to go the tooth implant in the socket, better than even to keep on the milk. Socket. Do you know, guys, what is the best? What is the best media? Not media. What is the best place, guys? Rather than milk, or the best is a socket, right? Yes, you're right, socket. Which of the following best determines the viability of periodontal ligament cells? Determine the viability of periodontal ligament cells and the guides the treatment plan for a vase permanent tooth. Exactly, replantation at the site within 15 minutes. Quickly, that's the best. This is a nature. The nature is the tooth should be kept in the socket. Any other thing's not important. On presentation 25 minutes post-injury, you did initial examination. Tooth 1 avulsed with an open apex, 2 intruded, approximately 3 millimeter. Okay. Upon arrival and based on your clinical examination, which tooth should be treated first? Avulsion, right? The avulsed tooth. 1 immediately, right? Before intrusion. Because intrusion don't do anything, just keep it. The intrusive tooth just to keep it, guys. Don't do anything in it. D delta, guys. What is the first step you should do next? Administer local anesthetic and prepare replantation. Irrigate socket with saline and replant the tooth. Obtain preapical radiograph before implantation. Prescribe antibiotics and delay replantation. Gold test. A is good. A is not bad, but C, it's much better. Diagnostic, guys, we like always, diagnostic option first. C is diagnostic. A is treatment. I would diagnose the condition first properly to see what's going on. Maybe I found some fracture. Maybe you can see some soil inside the socket. Maybe you can see some clot. Sorry, guys. Maybe, guys, you can see some clot inside. So take an X-ray, see what's going on. right? And then after this, you can do A. So C first, A second. Diagnostic, guys, option comes first. Please, guys, keep this in your mind. What is the most appropriate next step in managing tooth number 11 after confirming the socket is intact? Reimplant the tooth and splint for 4 weeks. Guys, what was, guys, the diagnosis, guys, for this tooth? Avulsion, right? Avulsion 2 weeks is enough. Avulsion 2 weeks is enough. So see, Charlie, what is the appropriate management for the intruded tooth to 1? Just guys, keep it under review. Keep your eyes on it. That's it. See, Charlie. Keep your eyes. Keep it under review. See, Charlie. His father asks, does he need for antibiotic? And if yes, which antibiotic? See, Charlie is good. Amoxicillin 500 milligrams, 8 hours for 7 days. Based on his age, his weight as well, but like seems like it's okay. And then definitely, guys, doxycycline not the first choice anymore. And doxycycline, we don't like to give it to people under 8-year-old. So, guys, the best answer here, guys, is C, Charlie. Following successful replantation and splinting treatment, which of the following is the most appropriate advice? A alpha, guys, the best. Rinse twice daily with 15 milliliter of 0.12% of chlorhexidine for 1 minute for 2 weeks. A alpha is the best. Question 9. What is the follow-up protocol for this advanced tooth with open apex? D delta is the best answer. You need to schedule follow-up at 2 weeks, 4 weeks, 3 months, 6 months, and 12 months, and then 3 years, 5 years, 7 years, 10 years. What clinical and radiographic sign should you monitor? That for the intruded tooth to 1, the intruded tooth to 1. Crown color change, yes. Infraocclusion, yes. Root resorption, yes. Pulp necrosis, yes. So all of the above. E echo. You are the senior dentist at With established 5-year chair emergency dental clinic at Melbourne. Melbourne. Okay, handling complex trauma cases on busy afternoon. Your junior colleague, okay, Sarah, approaches you with different trauma cases. Okay, Dr. Sarah shares the clinical findings and radiographs with you. The first one, the first case, was a concussion injury. What is appropriate management? E echo, no splint required. Question 2. The second case, Sarah asked you, what is the most likely diagnosis of the dental injury affecting tooth number 11? There is bleeding around the gums. Is it concussion? No. Concussion, no bleeding around the gums. Complicated crown fracture? No, there is no complicated crown fracture. Uncomplicated, I don't see any crown fracture. So the answer is D delta, subluxation. Why? Because there's bleeding around the gums. That's why it's subluxation rather than concussion. Concussion, no bleeding. No damage happening to the periodontal ligament. No injuries happening to periodontal ligament. That's why no bleeding for concussion case. Based on the diagnosis for tooth number 1-1, what is the most appropriate immediate management plan? It's just subluxation. 2 weeks is enough, right? Not too much damage has happened. Not that much damage. A little bit of injury only the periodontal ligament. So 2 weeks flexible splint, A alpha. Ah, this is crazy. Okay. Guys, look, guys, how the root locked in the bone. Yes, doctor, take X-ray for subluxation, yes. See, guys, what is diagnosed, guys, for this case? Okay, the tooth appears displaced and loose. Okay, this one displaced and loose. While in the second photograph, the tooth is displaced but immobile. Yeah, this is this. This photo is this photo. So, guys, what is the second one, guys, is lateral luxation. Anyway, the first one is extrusive luxation. Why? Because this one is going down and loose. But this one, even it can go down, depends on which is it buccal or lingual or palatal, but it's locked in the bone. That's why it's lateral luxation. Lateral luxation locked in the bone like this. And this, it's not locked, it's loose. So it is extrusive luxation. They came out of occlusal line. So the answer, guys, is D delta. The diagnosis was extrusive luxation. What is the most appropriate immediate management plan? A alpha, 2 weeks flexible splint for extrusive luxation. One of the diagnoses was lateral luxation injury. What is the appropriate management? B bravo is good. 2 to 4 weeks flexible splint. What is the most appropriate comprehensive management for the tooth with toothless lateral luxation? LA, yes. No problem. Give LA even with adrenaline, no problem. Manual repositioning. Good. Regis splint, wrong. A is wrong. B. Flexor splint, good. 2 weeks, no, it should be 4 weeks. C. Flexor splint, 4 weeks, good. Motopub and RCT only F, very good. Infection, very good. See, Charlie, guys. You know what? With the new guidelines, everyone was telling me, doctor, all the cases for lateral luxation, we should do RCT straight away. It's mentioned in trauma guidelines. I say, no. Doctor, someone told me, no. And the answer is no, you don't need. Right? You need only to get RCT if only there is infection or necrosis appear. See, Charlie got the right answer. Yes, doctor, subluxation, some cases needs for depends on how much subluxation happening. Some cases need for splinting, other case doesn't need for splinting. What complication can arise after the treatment? E echo, all of the above, but the most serious one is external inflammatory resorption. That's the most serious. B bravo. but the one it can happen first is ankylosis. Okay. What is the earliest sign of complication after lateral accession injuries? I would say C. Radiographic signs of resorption. And normally, guys, the resorption happens to interseptal bone. When you see the interseptal bone resorption happening, that means there's already complications start to happen. Answer, guys, C, Charlie. Question 10. What is the most serious and the earliest occurring complication if the lateral laxity is left untreated? Okay. This question, guys, somehow, right, as they ask about the most serious, look, the most serious, guys, you can divide this in two different questions, okay? The most serious is external inflammatory root resorption or replacement resorption. The earliest occurring will be ankylosis. Ginger pressure, no bone loss, no pain, no biting. Look, guys. Yeah, earliest, I would say A as really serious. You know what? The answer, guys, should be A. Should be A if you consider two together. Serious is ankylosis and the early ankylosis. If serious only will be B bravo. Serious only B bravo. Most serious and the earliest A alpha. Because ankylosis is really serious as well. It's still really ankylosis. Ankylosis is still serious. Tooth 1-1 display palatally with percussion tenderness. Okay. 2-1 dentin fracture. Okay. Enamel dentin. Guys, this scenario, guys, very, very important, by the way. Okay, guys, please, guys, this scenario very, very important. Okay, guys, this scenario is very important. Which factor is most important in deciding whether to reattach the broken tooth fragment of 2-1? B bravo. If, guys, the fragment is complete and fits properly, reattach it. If it's not complete, don't reattach it. If reattachment is not feasible, what is the best restorative approach, you guys, for 2-1? Composite, right? You need to reconstruct it using die composite restoration. See, Charlie. What additional baseline tests should be done aside from radiographs? Is he old child? Sorry, is he old man? If it's yes, so in this case we go with vitality sensibility testing using carbon dioxide stick. We like carbon dioxide stick for vitality or sensibility test. The answer, guys, C, Charlie. What is the most appropriate treatment for tooth 2-1 in this case? If because it's complicated, right? So we need to do civic pulpotomy. As we said, guys, before MTA, we now heading, guys, more toward MTA. Okay, guys, we are now as an most appropriate right now. They call it as an recent evidence-based. We're heading now, guys, more toward the MTA these days. E echo. Which tooth is expected to have a better prognosis? Be bravo, guys. Tooth number 2-1 has better prognosis than 1-1. Be bravo. What is the recommended initial treatment for tooth 1-1 with lateral luxation? As we say before, guys, we need to do digit by digital, guys, means manual. If you find the word in exam by digital, it means manual. Okay, guys? So C Charlie, manual repositioning and splint. If treatment for lateral luxation tooth 1-1 is delayed, which complication may occur? All of the above. Which one, guys, if this option will be the first? D delta. D delta. You remember we discussed question, we said radiographic resorption, guys? And then I said interseptal bone or marginal bone. So loss of marginal bone support may happen in a week time. Imagine, week. So D delta, guys, first. Then pulp necrosis. Then ankylosis, then external root resorption. Clear now, guys? D delta, B bravo, C Charlie, A alpha. Guys, please, guys, this order is very important. For the exam, it's very important. Question 8. What is the earliest clinical sign of complication tooth 1 on post-trauma? Yeah, we said it right now, right? D delta, guys, first. Okay, if you want to consider it, this one, guys, D delta first, pulp necrosis second, swelling third, ankylosis fourth, then external root resorption. Okay, now, guys, D first, B bravo second, which is pulp necrosis, E echo swelling third, ankylosis fourth, A alpha the last. Hopefully now clear. What is the most serious and the earliest complication of lateral luxation, guys? The same things. The most serious is external inflammatory. The earliest and most serious together, ankylosis. Ankylosis will be the most serious and the earliest together. Like C is both together. If they ask only about the most serious, A alpha. Question 10. What can be advised to prevent future dental trauma in active adults? What can be advised to prevent future dental trauma in active adults? By the way, guys, please, guys, listen to me. Guys, are you listening to me? Okay. I'm working right now, guys, on orthodontic Pedopedia, okay, and Be Delicious. If you have any question, and this question you believe it can help you in the exam, or any doubts, guys, please give it to me, on my personal Facebook account. Okay, guys, please, admin, are you there? Please, admin, can you share my personal Facebook account? Please, guys, I want to help you the best, okay? If you have any question about ortho and you believe this question something, it can help you in exam or you have doubts in it and related guys to the exam, related to our scope, please guys click on this. No, mouth guard is okay. Mouth guard, guys, we have lots of material about mouth guard. Don't worry about mouth guard. But tell me what exactly, guys, you need to like. Tell me what exactly you need to do about mouth guards, because I have already a separate delicious for mouth guards, all types of mouth guards, and why they being used in everything. Okay, guys. Okay, guys, I'm waiting, guys, for your questions, okay? Because I want to complete this bit delicious, and then I don't want to go back to it again. I will not, guys, revise it. I just will give it to you. So if you have any doubts, don't ask me after I finish it. If you have any doubts, you can ask now. Am I, guys, clear about this? Please, guys, I will not, guys, answer again. If you have any doubts about Otho, send it to me so I can include them. Be delicious, so guys, you can get the information ready to you. I hope this is clear. Okay? Any guys, like anything you believe can help you in exam. What can be advised to prevent future dental trauma in active adults? T-Chal is good. Using mouth guards or helmet guards is good. What if the patient, has class 2 modification, 1 malocclusion? What can be, guys, the best, guys, treatment? I'm talking about upper teeth. Class 2 modification, 1 malocclusion, guys. What can be the best? Will be, guys, orthodontic treatment, guys. Okay, guys? The answer is orthodontic treatment. Okay, guys? If the patient has class 2 modification 1 upper anterior teeth, which is protrusive upper anterior teeth, in this case, guys, we need for orthodontic treatment. Will be much because mouth guard will not help. Am I, guys, clear about this? Because his teeth already outside his mouth. Will not help. Ortho treatment, guys, will be the option. Okay. Okay. Guys, we done. We finished, guys. That's very good then. Okay. Please, guys, revise these questions again. Please, guys, answer the next questions because next time there is about another 160 question left. I may finish next time about 100. Next time, guys, I may finish about 100. And I need now to do my ortho, guys. I need to work on my orthopedicians as well. I'm going now to work on my orthopedicians. If treatment for lateral luxation to Swan 1 is delayed, which complication may occur? All of the above. All of the above. Okay? All of the above. Okay. Guys, I will let you guys. I will let you. Okay? I will let you know. Guys, Dr. Bavlo asking for paper 2. Do you guys have paper 2 right now? Will I guys approve paper 2? I'm happy, guys. As long as you say yes, I'm happy. Yes, doctor, no. No, yes, no, no, doctor, not yet, not yet, yes, please. I'm not sure. I'm confused now. Yes, doctor, yes, yes, no, yes, not yet, yes, not yet, yes. Okay, guys, let's see. I will double check, guys, and see, okay? But please, guys, ensure you finished Be Delicious and Bidopedia. Did you guys finish, guys, both Be Delicious and Bidopedia? Guys, no time, guys, please, guys. These are very easy stuff. No, guys, no, only videos, what? Why? Why? You already had enough time, guys. You have enough time. You have about more than a week now. Just a small. You are lazy now, you see? If I give you small things, you lazy. If I have give you a plan only to finish in 2 days, you should have told me only one thing left, doctor. You see now, I don't want to put pressure on you. And now Dr. Neshma, and I agree with her, said, so give pressure. I don't know if I give you pressure. Sorry, guys, you start crying. If I put you under pressure, start crying. If I give you space, you misuse it. Please give us pressure. Oh my God. Why I give you pressure, guys? You keep telling me, doctor, I didn't. I feel sorry for you. Okay. This is good, doctor. No pressure, please. The plan is to finish the stuff in your priority, guys. Like, guys, the plan is to finish the stuff. That's the only way to finish now. What's wrong with this? Okay, guys. Okay. Okay, guys. No problem, guys. No problem, please, guys. Use every single moment you have. If I put you under pressure, some candidates not happy. If I release the pressure, make things simple to you, and I rely on yourself, I rely that you really guys wanna pass and something important to you and things easy to you. It's just only some be delicious and some be bite with some questions to go through and this, listen to the recordings. This all shouldn't take more than 3-4 days, as we mentioned before. You just guys slow. Okay, guys, no problem. All the best, guys. I'm going now to finish my work. I'm going now, guys, to finish the ortho. Work on the ortho. Please, guys, give me your question, Dr. Bido. What's Dr. Bido? Dr. Mahnor, I have it already, Dr. Mahnor. And the right time, I give it to you. We're not yet in desensitization, Dr. Mahnor, okay? Once we get into this point, this part, I give it to you. Yes, Wednesday we finish paper 1, section 4 and 5 and maybe 6 even. I will do my best, guys, to finish all of them in one go. Okay, I'm very happy, guys, when I see guys you saying this way, okay? Guys, tomorrow, guys, is a session, okay, guys? Tomorrow, guys. Which topic, guys, would you like me to discuss tomorrow? What's going on with X-rays? No, guys, we still guys in paper 1. Why I wanna go with maybe ortho? Yes, maybe I can get some. Maybe we can do case tomorrow for ortho. Okay, no problem. However, we haven't covered then ortho because the last paper will be ortho anyway. The last paper will be ortho. Okay, guys, no problem. Thank you very much, guys. Please, guys, any question you have about ortho, please, guys, share it with me so I can cover in my orthopedopedia, guys. Okay? Thank you very much, guys. Thank you very much. Have a great night, every one of you guys. Yes, Dr. Fatima. Yes, I'm working on this one too, guys. I'm working on this stuff all together. Okay. Thank you very much, guys. Have a great night, everyone. As if Dr. Fatima finished everything, and she is now just only waiting for the 70 question mock. And she is the one. I'm not sure she said this or not, but I think she's one of the people she didn't finish. No problem. Thank you. Who's this, Dr. Daniel? We love you, Doctor. Is that for me, Dr. Daniel, or someone else? Thank you very much. If this for me, I love you all guys as well. Love every one of you. Thank you very much, Daniel, for this. Dr. Daniel. Thank you very much, you guys. Have a great night, guys. Every one of you. Thank you very much, you guys. Thank you.